Hi there. Thank you so much for watching. Please remember to subscribe to the channel, click on the notifications, and also like the videos here on YouTube. Also, remember to check out the playlist for more videos to do with cosmetic surgery. Hi there. Thank you so much for joining me today. Today we're speaking to a lady called Carly, and we're going to be speaking about different post-op care treatments that she does there at her clinic. Hi there, Carly. How are you?
Hi, I'm doing great. Thank you so much for
That's
having me.
that's brilliant. Just tell me a little bit about what you do there at your clinic.
Yes, so I am the owner of Folsom Post-Op Care here in Folsom, California, where I specialize in massage therapy for women recovering from surgery. And it can be anywhere from cesareans, abdominal surgeries, mommy makeovers, and
Okay,
tummy tucks.
that's brilliant. And do clients come to you in your facility, or do you do any mobile care as well?
So it's all in office right now.
Okay, that's brilliant.
And as far as expansion into a mobile service, that's kind of up in the air. But for right now, it's all in office.
That's great. So today we're going to be talking about kind of something that you specialize in, which is the scar treatments. Could you just tell me a little bit, first of all, a lot of people, obviously, when they have the cosmetic surgery, they will develop scars. Do some people develop scars more than others?
So for the most part, every body is different from their chemistry, the way they are living. All of that
Mm,
plays a huge factor into the healing process and how fast they're going to heal. And also um, what that scar, like how the collagen builds up. So it really
mm.
varies person to person. No one is the same.
Yeah. I mean, I do see some people that have hardly, it's kind of invisible, and then other people, their scars are really, really bad, and they say that they scar a lot. So what kind of things can you do to help them then?
Yes. So typically the treatment process here, it's about 4 sessions that can really help to soften and dissolve that scar.
Okay.
And that's going to help with any restriction of movement. It's also going to help with drainage so that nutrients can flow in and easily flow out. And the big thing here is we don't want any adhesions, and we want to be able to soften that scar so that it doesn't create any problems down the line.
Okay, okay, brilliant. So, how soon after somebody has surgery would you recommend that they start treatments on scars? I take it the wound has to be fully healed, or is that not correct?
Yes, exactly. 6 to 8 weeks is when I want to see clients, and I have them come in immediately. And the sooner that we can work on the scar, the better. I do have clients who I'm seeing who have not ever touched their scar for
Hmm.
10 years.
Oh,
So
okay.
I'm able to work on them as well. That density of the scar is going to be a lot thicker.
Mm.
So that's why it's highly recommended to get on the aftercare immediately.
Right. So, what you're basically saying is like the sooner that you get the treatment, is it going to be more effective?
Absolutely.
Right.
Absolutely.
Okay, okay, that's great. So, what would say for cosmetic surgery, what would be like scars that you'd see kind of remaining the most, or would they all be the same?
So anchor incisions, I see they're a little bit more prominent. So
Mm,
it does take a little bit longer for those to heal. And with those incisions, they're typically that can take maybe sessions. And what for the treatment, what I'm usually doing is I apply special oils and
okay.
special manipulation of that scar. And then I apply a castor pack, which is going to help to soak up any toxins and also
Hmm.
help with drainage of that area. And really, really important process for the body because you also want to protect that investment. You
Yeah.
don't want to have it bite you in the
Hmm.
long run there.
Yeah. That's
Yeah.
great. So tell me, is there anything that a client kind of can do or should be doing or needs to do to prepare for the treatment, or even just themselves is there anything they can do to make their scar less themselves?
Yeah, so drinking lots of water is very important. As far as nutrition, that's not in my scope of practice, but it would be highly recommended to see a nutritionist and also to consult with your doctor for that part. But water intake is very important, and staying moving. Um, that's also greatly
Yeah.
important for the body.
Okay, that's great. So just tell me, when it comes to a scar that would be quite old, and you say you do treat people like that as well, do you see like a significant improvement after your treatments, would you say?
Yes, absolutely. So, as far as even just one session, I'm having clients who feel less restriction in their abdomen. And
Mm.
I mean, that right there is huge. And then, as far as I've had clients who are just able to clean their house. I know that's kind of wild, but like they just feel great. They're not
Yeah,
feeling any restriction. They're not feeling any type of chemical imbalance in their body.
yeah.
So it's
Okay.
good to get the blood flowing and get that
Mm,
lymph flowing
yeah,
in order to see progress in the body.
that's great. So tell me, how many sessions and what's the time frame between the sessions would you really recommend? Just say, for instance, if I've had a tummy tuck done, and I know sometimes you can feel like scar tissue underneath the wound as well. So what would you say is the most effective in your experience, and even how long? Say if someone wanted to do them for a long time, what would you say that you really need to be doing to see a significant improvement?
So really just 2 sessions a week
Okay.
would be great, like, right after your surgery, coming in
Mm,
for 2 times that week, maybe, like, Monday and a Thursday, and then, another 2 days the next week, and
right.
really that you can see a whole lot just right there in 4 sessions,
That's great.
and then from there, maintenance is really important as well. I
Mm,
will teach my clients how to even do, self manipulation so that if they're
okay.
just in their own home, they can do this
Yeah.
as well. Just because it is important to take care of the body and to
Mm,
take care of that area. And so then
mm,
just meeting with me even once a month is
yeah.
is great as well. It's just those little steps that can really improve the overall function of their body.
That's brilliant. That's brilliant. So last question for you. Just tell me like what sort of prices would you be charging for your service?
So as far as pricing, I have that all listed on my website. So clients, if
Okay.
they're interested, they can go and check that out. I
Mm,
also offer different packages, so I'm able to work with clients and what it is that their specific goals might be
okay.
as
So
well.
tailor it towards the different client then, yeah?
Yes, absolutely.
That's brilliant. Well, thank you so much for speaking to me today. It's been absolutely brilliant. I'm going to put all of your contact details in the video below in the comments. So anyone who wants to get in contact with you can do so. Is that okay?
Yeah, absolutely. Thank you so
That's
much.
brilliant. Thank you so much.